Congratulations on your pregnancy. This segment is for moms-to-be that are between 12 and 16 weeks gestation. So by this time, you've had your initial exam done, you've had your prenatal labs done, and you should have gotten the results in your portal. You have confirmed your pregnancy with a positive pregnancy test. You've had an ultrasound that's going to give you your due date, and that due date is not going to change. Some of you might still be having some of the symptoms that you were feeling at the beginning of the pregnancy. You might feel fatigued, you might have headaches, you might still be feeling nausea. So still make sure that you're taking naps. Tylenol is fine to take during this time in pregnancy. You might want to put an ice pack on your head. You want to relax as much as possible. Have someone do your cooking and your cleaning for you. Elicit your family members to help out with the other kids if you have them. You might want to take a yoga class or any kind of relaxation techniques and just put your feet up and relax. It's not uncommon to have some mild cramping during this time, and you might be having some pulling and stretching along the sides of your lower abdomen. That might be consistent with round ligament pain. And so I would advise you to just put a little heating pack on that side. You can take a Tylenol, and even if you lean to the side for about 10 minutes, that should give you some relief. Some of you might be lucky enough not to have any symptoms at all, and that's okay. But this could be a very stressful time. Not being able to feel the baby move yet, and not seeing your belly grow as much, you might wonder, am I really pregnant? So every time you come into your visit, we're going to listen to the heartbeat. We're going to palpate your abdomen and check your blood pressure. Each visit after we check your blood pressure and get your weight, we're going to make sure we listen to the baby's heart tones. It's common to feel a little anxious and worry about what's coming next. It's very anxiety provoking to think about being a parent for the first time or adding a new addition to your family. And your body's going through a lot of changes. So just try to relax, use de-stressing methods, and get as much rest as possible. It's also very important to keep up with your nutrition. You want to make sure that you're having 3 meals a day, plus snacks in between, and also keeping up on your hydration. Water is the best. You're going to make sure that you schedule out your appointments and keep your appointments. It's very important for us to see you at the scheduled time. At the beginning of the pregnancy, you're going to be coming every 4 weeks until about 28 weeks. Then after 28 weeks, you're going to be coming every 2 weeks until about 36 weeks. And then it will be weekly. At this gestational age, your provider may offer you genetic testing. That is a blood test. The blood test is going to screen your baby for any kind of genetic abnormalities like a trisomy. And the good part of that is that you can also get the gender of your baby. Your provider may also offer you genetic screening for yourself to see if you have 14 of the most common types of genetic disorders. These tests are offered, but they're not mandatory. So if you decide not to have these tests done, it's completely okay. What's coming next is that you'll probably be scheduled for your anatomy scan. That's done between 20 to 22 weeks. That's a very exciting visit because that's when you can get to see your baby.